what is maybe the key part of this topic that you think is the most like misunderstood?
I think the key take home is that obesity is a very chronic and complex disease, and that neither surgery nor medications are curative. And given that this is a life course issue, what we need to do is look at what combinations of therapies our patients are going to need over the course of their life in order to have a healthier weight, which will infer then health benefits and then also improvements or optimization in quality of life.
Hmm. What do you think in general? I know that it depends on like the factors associated with the specific patient. Are there any strategies or post-operative care resources, programs, or kind of courses of action that seem to be most effective for people? What practitioners need to be involved? Because part of me thinking that has to be approached from like a multidisciplinary perspective, depending on what the patient's going through. But what's usually the game plan for a successful, meaning like, somewhat stable resting point for a patient? What's the typical game plan?
Again, unfortunately, a lot of patients in a bariatric care setting are lost to follow up over time.
Mm.
There are care algorithms that suggest appropriate intervals at which patients are meant to be seen back, undergo micronutrient testing to make sure that the micronutrient supplements that they're meant to be taking lifelong are meeting their nutritional needs, bone density assessments to make sure they're not losing excess bone density as part of both the weight loss journey and then also the malnutrition that can occur after bariatric surgery too. So regular follow-up in a center that is accustomed to and trained in looking after patients after bariatric surgery, or providing our primary care colleagues with additional education and resources on how to care for people after bariatric surgery, I think is key to this too.
Mm. What areas of research, maybe emerging or already established, do you think are kind of the most interesting to you, or
Mhm.
that you're that are the most exciting for you?
Sure. I think if we're talking about post-bariatric care and weight optimization,
Mm.
I think questions are which agents are most effective for treating weight recurrence or weight regain after bariatric surgery. Research that we've done at our center has shown that GLP-1 or incretin-based therapies appear to be more effective as we get new and emerging therapies that work on different receptors and have different mechanisms of action in the body. I think it'll be about looking at, well, which ones have the best health benefits in addition to the weight reduction and not solely look at weight reducing potential. I think the other angle to look at this as well is when do we start medications? Is it appropriate to start a medication for someone living with severe obesity before surgery and start it straight back after? Do we wait until the weight loss trajectory slows or until they plateau? Or if they achieve X% weight recurrence? We really don't have great answers in terms of when to start, but some studies, which are small, would suggest that starting medications before surgery and starting them early before weight recurrence is experienced will likely lead to greater weight reduction.